Hello, welcome to our group innovation assignment for GED. Right now it's Akira talking, and I'm here with Olivia, Roxy, and Kiara. Hello.
Yeah, that was Olivia. And
Yeah.
Hi, here's Roxy.
That was Kiara. Okay, so for our group discussion, we will be talking about laser therapy, or therapeutic lasers. Alright, so human lasers have been around since the 1960s. They were utilized in the medical field. They were first used on rats and have made great advancement in treating diseases, wounds, and other painful medical conditions for humans. Although this was done in the 1960s, it's been oh my god, words. It wasn't until around 2002 that the FDA, which is the Food and Drug Administration, finally legalized the use of laser therapy treatment in the veterinary field. So it's been pretty new. It's a pretty new, innovative tool compared to human laser therapy, which has become quite more advanced in the past several years compared to animal therapy. Not every clinic uses laser therapy, or hospitals as well, but many professionals in the veterinary field have started to look more into it and progress in information and techniques using laser therapy for animal treatments. So first, we're going to talk about a couple positives that are needed. First, we're going to talk about a couple of positives found using therapeutic lasers in the veterinary field. One of the reasons why therapeutic lasers are beneficial and used as a innovative medical tool in the veterinary field is that it helps treat muscle pain relief, many joint and joint pain. It also is used in post-operative recovery, especially around surgical incisions, which are very sensitive areas. It can also help promote faster healing of the wounds and helps manage musculoskeletal pain in animals.
With those positives, there are also some positives towards the pet owners themselves. Since with laser therapy, it is a class 3 laser, so it doesn't get to the level of lasers that are used for cauterizing wounds, which is a class 4. So it doesn't cause any burning or heating unless you hold it over an area for a long period of time. So it makes it really good for pet owners, because a lot of pet owners are worried about having to shave the area of the animal, especially with show dogs, where, say they're with agility dogs or show dogs where they possibly get an injury, they can't get shaved because they could possibly get deducted with points for any future showings. So it's really good because they don't have to do that. They can go directly over the fur, and it won't cause any problems unless they keep it over the area for too long. It also serves with adding on to Akira's point there. She talked about how it's really good for muscular pain relief and treating osteoarthritis. It also helps to aid in healing for bone fractures, any benign granulomas, any tendon injuries. It can also be added on to any acupuncture therapy that is part of the... It's used for innovations with acupuncture and other medications. It could be added on with that, but I think it's pretty beneficial because it's it can be used on its own or with other treatment options. A lot of times in human medicine, they add laser therapy along with ultrasound therapy and acupuncture and stuff. And I think that'd be pretty beneficial in the veterinary field, as they can add on to future treatments. And I think there's room for a lot of growth in the veterinary field.
First I want to add some like positive part of the what Liv just talked about is the like acupuncture thing, because I have like traditional Chinese veterinary medicine education background, and we are not only use needle for acupuncture, we use a lot of laser therapy like instead of the needle, and I find like that clients are more acceptable for using laser, because like needle can still a little bit invasive, but laser therapy is not that invasive to our clients. And it just under the traditional Chinese veterinary medicine theory, we use the laser at the acupoints we choose, and it turned out pretty good in the clinical case. And I think just like Liv said, this laser therapy can combine with many other integrative treatment methods, which kind of make up the whole integrative. That's the word, right? Integrative, like combine all the like multimodal, integrative, multimodal therapy thing, like to help patient rehabilitation or like control pain or that stuff, like help us get more tools to treat or like slow down the progress or relieve the disease that modern practice or surgery cannot deal with. So that's why I find it's really valuable. And Liv, I think you just mentioned like you had laser therapy experience, right?
Yeah.
Do you want to share some like your thoughts or your feeling about your laser therapy experience?
Yeah, so I have some problems with my back, and I've used mainly ultrasound therapy, but my physiotherapist asked me, he was like, we do have some other options such as acupuncture or laser therapy, and I don't really know how I'd feel about the acupuncture, especially because it's in my hip, like in my low back. So
It's also good.
Yes. But with the electrotherapy, I thought maybe I'll try some laser therapy. And it actually, because with my condition, I would get relief for a few days and then have to come back. But I noticed that it extended my relief period. Like I felt pain less for longer periods of time before I'd have to come back. And I think that's really important for a lot of pet owners, because the more they do it, like, yes, as a cure, or we'll talk about this in a little bit with multiple sessions, but I think it's really good for owners because the more they do it, the effects will stay for longer. And I think that's good because then it's eliminating possible other treatments, maybe less medications, because a lot of owners sometimes are a little iffy with giving their medications to animals. Some animals are also fractious, and they're like, I think it's really good.
Difficult to
animals can be difficult to pill, so I think this is a good alternative for something.
The stress of a lot of
Yeah.
Animals and pet owner
Yeah.
combinations.
And it's warm and cozy, and cats especially, they love heat. So I think it's good. I think
until
it's a
they
good
get
thing.
fried by a laser. But
But
that's in the negatives. We
don't
talking
wanna
about
talk
that right now.
Okay.
No, thanks for asking. Yeah, no, I think it's it helped me a lot, so I hope it can help a lot of animals in the future, and I hope we get more studies and it grows for that.
Yeah.
Yeah.
Thanks for Liv's sharing of her experience.
You're welcome.
And I'm going to talk about some like negative parts of the laser therapy. First, I do want to say like for this therapy, it's kind of like really new, and it only be practiced mostly in labs, like on the lab animals, and also not long enough for human medicine to know. So there's be shorter it used in veterinary medicine. So we actually do not have amount of like enough clinical cases based evidence to actually like prove that it really makes a difference. So I think that's kind of like one of the negative parts because our clients, the animals owners, always want to ask like, when will my pets get better? Like how many sessions I need that I can see difference, because pets, like animals, aren't like human. When people feel good, they can talk to the doctor like, oh, I do feel good, even though there's no like scientific number or index to show that, but people's feeling is really matter in our like in medical field. But we cannot tell that from like directly from our animals. I think that's one of the reason why there is not a lot of like case-based evidence for that. But I think all the doctors are trying to make up for that part, because we are now, it's kind of like really wild spread here. And we just like the doctors need to collect the data and try to do the statistics, like the math thing to determine like whether it's really help. So I think that is on progress. So I think it's acceptable. Like we don't have so many evidence now since it's really new.
I think in
but we
veterinary
are
medicine, it definitely takes more time to find these studies, because you're right. Like it's not like the animals can tell us if they're feeling better. So sometimes it takes a lot of time. A lot of owners don't have the patience for that kind of stuff.
Yeah.
So I can definitely see
With
the problem in that.
With cats, because they'll like hide things too, so it can be, it's like some things can take longer than you expect when it comes to finding like a diagnosis and stuff like that.
Yeah, and I think all the staff in the veterinary medicine field are keeping working on that to try to like actually can give the numbers to our clients, like laser therapy really help.
Another negative, kind of like how everyone else mentioned before, is that because it takes so many, like there's so many multiple sessions, these sessions can take like 2 to 5 weeks to go through, and acute issues are often addressed more frequently but over a shorter duration, whereas chronic conditions are managed with less frequent sessions but over a longer period. And this could be very expensive for pet owners, which can sometimes lead them to not wanting to do laser therapy. And another thing that goes with having to do multiple sessions is that already therapeutic lasers can promote tumor growth, and when there's so many different sessions, they're more exposed to these lasers continuously, which can be a safety issue, which is very dangerous to operate if not used correctly. And of course, misuse can lead to serious injury of the animal and the surrounding staff as well.
Because if you don't have the proper eye protection, or like I was talking about earlier, like if you hold it over the area for too long, like that can burn. So we definitely need more training on the field.
Yeah, but I think that part is like can be solved.
Yeah.
Like, we need like PPE, like personal protective equipment, and also it should be carried out by trained staff, not some random people just can do the laser therapy. So I think that part can be like more regulated, and like under regulation things, and have the like the protocol how to do that to minimize the risks of all that stuff. And for the long session treatment, I think it's kind of like not fair for laser therapy to be expected can have effect in short term, because some of the like the medical conditions we using laser therapy to treat is like chronic thing, and can be, even if in modern veterinary practice you need to take a long time, even like a lifelong time medication to control that. So we cannot expect like we do once or twice laser therapy it can cure that. So I think that's my opinion about the long session treatment part. And
I think another thing with having long sessions is that it can put the animals under a lot of stress, because they're constantly going back and forth, having to do laser therapy, so it can be very stressful for the animals. And then that can also make the animals' owners very stressful too, so it's kind of hard to make it a very positive experience.
And so to conclude everything, we all agreed that we believe that there's more positives to laser therapy as an innovative technology tool compared to the negatives that we just talked about. So we hope in the future that this technology can become a more advanced, more progressed, and safe tool used in the veterinary field. Thank you.
Thank you.